Hello, welcome back, friends. So we were currently discussing about the common anticoagulants used in laboratory. In previous lecture, we have talked about various types of blood collection. So this part will be following after once we have collected the blood sample. There are standard five anticoagulants which are commonly used in any clinical laboratory in which the double oxalate EDTA or the full form ethylene diamine tetraacetic acid, heparin, sodium citrate and sodium fluoride. So let's check one by one and their importance. So double oxalate anticoagulant, which is a mixture of ammonium and potassium oxalate, which is primarily used in hematology for collecting blood sample for specific laboratory test, in which the amount which is taken is, let me show it with the laser, zero point 0.5 ml anticoagulant for 5 ml blood. So what it does is this anticoagulant removes the free calcium ions from the solution through the addition of ammonium and potassium oxalate, which is present, and why it is called as double oxalate ions. Basically, this double oxalate are used to do the specific tests such as ESR method using a Wintrop's method, then packed cell volume determination. So this procedure helps to because it is having a two ions or we can say two oxalate. So this will help anticoagulate the blood. Now calcium will be precipitated as insoluble calcium oxalate. So whatever calcium's ions which are present inside the anticoagulant will be insoluble, will become insoluble. So basically any anticoagulant if you talk about are some way trying to work as a stopping the blood from the clotting. Okay, that's why the reason it's called is anticoagulant. So and double oxalate ion will chelate or precipitate the calcium ions. Now, whatever the blood we collect in this type of anticoagulant are not suitable for morphological examinations. The reason behind it is as it is having two oxalates, this may create some bizarre nuclear patterns on the white blood cells or red blood cells. Uh, Apart from this also, this is also uh, try to interfere with the morphology of WBCs as well. Next anticoagulant will be the very common anticoagulant used in the laboratory and which is highly soluble and which is mostly used in the lab for the general purposes such as CBC count. So it contains the ethylene diamide triacetic acid and it is available in the three forms. The first form which is tri-potassium EDTA, second is disodium EDTA and third is dilithium EDTA. In this mostly the potassium salts in tri-potassium EDTA are more readily soluble in the blood, usually they are preferred over other two uh, you know types of EDTA. So EDTA can be a crystalline or liquid. So it can be found in both. Nowadays, the disposable vacutainers of EDTA comes in the crystalline form. Liquid EDTA tubes require specific filling volume to avoid dilution effect. So, what is the meaning of dilution effect? Is sometimes it may happen that you have added more amount of EDTA, and due to this reason, you may get the fluctuating results in whatever test you perform on the blood. So, blood to anticoagulant ratio must be kept maintained and in the balance. So usually this applicable to the all anticoagulants which we will talk about in this lecture. So EDTA is also known as Vercin or sequestratin. The reason behind it is a liquid which has the similar name to this, and probably in examination this can be asked. So EDTA can also act as a chelating or removing the ionized calcium. Uh, Ionized calcium is why this anticoagulant chelates or removes the calcium ion. So one of the reason is to stop the blood from clotting, and before going into the anticoagulants, you must understand how blood clotting occurs, and what are the important factors that can contribute to the blood clotting. So one of the factor and major factor we can call is calcium. So if we somehow can chelate or remove the calcium, then blood clotting will not occur. Also, the dry potassium EDTA is preferred in case of the anticoagulant tubes. Now, the test tubes of EDTA will look like this. This having a purple color, and it comes in a various types that we have just talked in previous session, previous slide. Functions of this EDTA will basically remove the calcium ions. Uses of this vacutainer is used in most of the hematological studies. So, in case if you say hematological study, that means in most peripheral blood smears, then we can talk about CBC, then PCR, then HbA1c, all the tests related to the hematology that will be done using EDTA tubes. This requires a full draw, meaning whenever I say a full draw doesn't mean you have to fill up like up to here. Uh, Whenever you use any vacutainer, there is a arrow given here, or we can say marking given here, only till that mark you have to fill up. Next test tube is of sodium citrate, which comes in the blue color. The ratio of blood to anticoagulants in 1:9 for sodium citrate. This anticoagulant comes in 32 gram per liter. It also acts as it removes the calcium ions to perform its anticoagulant activity. The use of this anticoagulant is for all the coagulation studies such as prothrombin time and partial thromboplastin time, or APTT such as activated partial thromboplastin time, and platelet functions. Next test tube also sodium citrate, but this citrate is somewhat different from the previous one, the blue one. This comes in the black color, but the ratio over there for the blue it was 1:9, but in this the ratio of blood to anticoagulant is 1:4, and this works similarly, but the use of this is somewhat different and very specific. So whenever there is a black vacutainer and the sodium citrate is filled with ratio of 1:4, then you should immediately understand that this test we will perform on this anticoagulant. And usually additive we use is 3.8% sodium citrate. Next test is heparin, having the dark green tubes, and it comes in two forms: sodium or lithium heparin anticoagulant. The action of this tube will inactivate the thrombin and thromboplastin, which are very essential parts or essential factors of the blood clotting. This heparin tubes will be used for lithium levels checking in the blood, or sometimes in the arterial blood collection. The red color tube, or we can say a plain tube having no preservatives or anticoagulants, comes in a red. This usually requires for the blood bank test, or we can say cross matching and ABO blood grouping test, toxicology test, biochemistry test, and serological test. So mostly in toxicology, biochemistry, and serology test, the uh, whatever the methods are already assigned requires this serum. So whenever we require a serum, then we must use the red vacutainer. Whenever we require a plasma, then we need to use this any anticoagulant designed for a specific test. The next is a golden topped tube. This is a very unique tube, very lessly used in laboratory, but still it is essential to understand, which is also called as serum separator tube or gel tube. So basically no additives added, no anticoagulants are added, but there is something added which is called as clotting accelerators and separating gel. So this will help blood clotting very fast, and this also used in the any test which requires the serum such as chemistry, immunology, and serology. And the last test vials which are usually comes in the light green color, PST, meaning plasma separating tube. This also comes with the lithium heparin solution inside it, and mostly it is used for the chemistries. So, whenever we are using the highly preferred vial EDTA, then first we should mix the blood with the anticoagulant in a manner which is guaranteeing us the proper mixture of the blood and anticoagulant. Sometimes it may happen if you don't mix properly, then some blood clots may be there in the blood. So this shouldn't be happen because this may alter with the results. So usually inversing it 20 times will make it properly mixed with the blood. You should not shake it very harshly because vigorous shaking may be uh, affect your blood uh, integrity, such as it can hemolyze the blood, and then disintegration of the cells may happen. Also, the EDTA is most commonly used anticoagulant and choice of the anticoagulant for the CBC test. Excess amount of EDTA can cause shrinkage of the RBCs, so cells may get damaged with the higher amount of anticoagulants. This may interfere with the HCT, MCH, HC values. This you can see in a further CBC test report. So whenever you see something like there is a fluctuations in these indices, red cell indices, then you must immediately either take the collection again. Okay. So the platelets are also affected by this, you know, higher amount of EDTA. Heparin, which is an acid mucopolysaccharide, which acts as complexing with the antithrombin. So this eventually will prevent the blood from the clotting, and this is one of the anticoagulant which is natural anticoagulant. So probably there is one natural anticoagulant available for our laboratory use, which is heparin. Usually, heparin is not suitable for the blood film staining because it gives too blue coloration in the black background. So we may not be able to have a good contrast to see the blood films in under microscope. Heparin is usually preferred anticoagulant for osmotic fragility testing, where you take a blood and put a drop in the solution containing, I think the solution is HCl. So whenever you add the drop of blood in this particular solution, then you have to observe the drop, which how long does it take to you know drop to the bottom. Next, heparin can be used for LE cell preparation. LE means lupus erythematosus. Also, heparin is preferred anticoagulant for osmotic fragility testing that we have already talked about. Also, hematocrit we can get from this HCT, and it is heparin is found usually in basophils and mast cell granules, and heparin can be also used therapeutically for in vivo anticoagulant. Then sodium citrate, which is most commonly used anticoagulant, but mainly used for citrated plasma and evaluation of coagulation disorders, as it is not inhibitory to the calcium ions. So basically, if we talk about citrate, then it is used as a all the coagulation studies such as PT, APTT, as well as it is used for the ESR. Okay, and usually it works as precipitating the calcium ions. It comes in the liquid form, 3.8% dry sodium citrate, and the ratio that we have observed was the two different ratios are used. If you are using 9 volumes of the blood to the 1 volume of anticoagulant, which is very critical, and when are you using 4 volume of blood and 1 volume of anticoagulant, in previous time I may have mistakenly said the vice versa, but 4 times will be the having the blood and 1 time only having the anticoagulant, so which is suitable for the different test, right? So, usually the diluent anticoagulant is used for the ESR, and others can be used for the coagulation studies, but this both cannot be used for the CBC. Then the last anticoagulant for today's session will be the sodium fluoride. You may have used this anticoagulant very often with the diabetic patients for the glucose estimation, right? And urea estimation you can also perform in this anticoagulants. So basically, fluoride inhibits the glycolic enzymes present there, and by inhibiting the glycolic enzyme, it prevents the loss of glucose during the transportation. So basically, it will preserve the glucose levels inside the blood. So whenever if there is a delay in specimen handling, let's say we have a very higher workload at the laboratory, then we can take the blood samples in the sodium fluoride tube. So you know we can then, after some time, if we do the glucose test using plasma, then the glucose may not give you a fluctuating result, but the similar results. So thank you for listening to me, and this is over for the our second topic, which was the common anticoagulants used in the hematology lab. uh, for next lecture, we are going to see as syllabus wise. So thank you again.